right, everyone, get ready because today we're diving deep, deep into the world of Gen Z and how they're totally about to change healthcare as we know it. We've got this awesome article from Healthy Systems. It's called From A to Z, 5 Population Considerations for Gen Z, and it's going to guide us through this.
Yeah, it's a really cool look at how this generation, the folks born between the mid 90s and the early 2010s, they're bringing some totally new experiences and expectations to the table.
Right, and this is not just some, random thing. These are the people who are about to be running the show. By 2030, they'll be almost a third of the workforce. So, figuring out how they feel about healthcare. That's going to be super important, especially for, anyone who works with, say, workers' comp or benefits.
Oh yeah, for sure. And it's wild to think that their whole childhood was shaped by these huge events. 9/11, the recession back in 2008, social media blowing up, and then bam, a global pandemic hits.
Whoa! Right? It makes you think about how all that, messed with their outlook. I mean, the article talks about some pretty scary stats about Gen Z and mental health. 1 in 4 of them where they felt emotionally distressed. 1 in 4.
Yeah, that's intense. And it really shows just how bad the mental health crisis is for this generation. Researchers think all those crazy events we talked about, they definitely had a big impact, created this feeling of uncertainty and anxiety that they're still dealing with.
Okay, so let's think about this for a sec. How does all this mental health stuff affect, say, someone who manages a team or someone planning those, wellness programs at work?
Well, it means we got to rethink the whole, employee well-being thing. We might see more people missing work, more problems with workers' comp claims, and a way bigger need for, easy-to-access mental health resources. And this is where things get even trickier.
Because, we don't have enough therapists and stuff. The article said something like 64% of U.S. counties have a shortage.
Exactly. So you got this generation, right, struggling with their mental health more than ever before. And on top of that, the healthcare system is totally not ready to help them. It's a huge problem that needs some serious attention.
All right, so we've got this whole mental health thing going on. Now let's switch gears for a minute and talk about Gen Z and drugs and alcohol. From what the article said, it sounds like a pretty mixed bag.
Yeah, it's definitely complicated. On the one hand, you've got this whole sober curious thing happening. Gen Z is actually drinking less alcohol than, older generation.
Which is awesome.
Totally. It shows they're more aware of what they're putting in their bodies. They're thinking about their well-being. And we're also seeing them change their minds about marijuana. 71% of them support making it legal.
Wait a minute, isn't that kind of contradictory? Embracing marijuana but being all sober curious?
Yeah, it is interesting, right? It shows that we need to have more nuanced conversations about substance use. Gen Z might be cool with cannabis, but not into the whole, party hard culture of alcohol.
It definitely challenges the old school idea of what substance use even is. It's not so black and white anymore. But then, there's vaping, which the article made it sound like a whole different animal.
Right. While we see good things happening with alcohol, less drinking, the whole e-cigarette thing is a major problem for public health.
The stats are pretty freaky. E-cigarette use among high schoolers, it jumped from 1.5% to 27.5% in under 10 years. And almost half of underage vapors are getting their vapes from, regular stores, not some shady back alley deal.
Yeah, it's way too easy for them to get their hands on them. And what makes it even worse is that there's a ton of misinformation about vaping, especially among young people. They think it's harmless.
So for someone in charge of safety at work, what should they take away from all this?
Well, I think it's crucial for them to understand these trends. The whole sober curious thing, how the laws around marijuana are changing, the dangers of vaping. They might need to, rethink their drug policies, maybe even offer some educational programs and really understand what, Gen Z employees are dealing with when it comes to substance use, because it's a different world than it used to be. It really shows you we need to get them understand this generation better, how they think about health and well-being and all that. And that's super important when we look at this other thing the Healthy Systems article talked about, this whole digital gap thing.
Oh, yeah, this is where it gets kind of weird, right? Gen Z, they practically live online, but they might actually have trouble with tech at work?
Exactly. It's not that they, don't know how to use computers and stuff. They grew up with smartphones, social media. They're pros at all of that.
So what's the problem?
The problem is the kind of tech they're used to and the whole user experience. Gen Z, they expect things to be simple, sleek designs, everything works on their phone. Then they get to work and it's ancient history, clunky software, systems that look like they're from the Stone Age.
Oh, I totally get that. Imagine growing up with your smartphone. Everything's super fast, super responsive. And then you got to do some system at work that takes like 5 minutes per load.
I know, right? And it's not just about being annoying. This tech gap can actually make people less productive and even like less happy with their jobs. If the tools they used are a pain, it just makes everything harder.
So what does this mean for, bosses and companies and all that?
It means they got to realize that just because someone's Gen Z doesn't mean they're automatically a tech whiz in the workplace. They might need to invest in better systems, stuff that's more user-friendly and modern, and maybe offer more training on the specific software they use.
It's almost like, they got to bridge this like technology gap between generations.
Yeah, kinda. And speaking of technology, that screen time, it's having another crazy effect. The article talks about eye strain and how it's becoming a bigger and bigger problem.
Right. Yeah. I mean, we've all had that feeling like our eyes are fried after staring at a screen all day. But for Gen Z, it's like a million times worse, right?
Totally. The average Gen Zer spends, get this, something like 7 hours a day looking at screens.
7 hours.
Yeah, it's crazy. And all that screen time is definitely taking a toll. We're seeing more and more young people with myopia, nearsightedness, and it's probably because of all the screens.
And it's not just needing glasses, right? The article mentioned things like headaches, even accidents at work, because people can't see properly.
Yeah, it's true. And some people might even need surgery later on. It's a whole bunch of potential problems. And the predictions are honestly kind of scary. By 2050, they think half the world's population could be nearsighted.
Whoa, that's a lot of people. So, like, what can we even do about it? We can't exactly tell Gen Z to, throw away their phones and computers.
True, true. But we can, encourage them to be smarter about their screen time. Take breaks, look away from the screen every once in a while. There's this thing called the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. It helps rest your eyes. And get regular eye exams, of course.
Yeah, that makes sense. What about, like, at work? Can employers do anything to help?
Definitely. They need to think about ergonomics. Make sure people's workspaces are set up in a way that doesn't strain their eyes.
Okay, so we've talked about mental health, substance use, the whole digital thing, and now eye strain. Lots to think about, especially if you want to understand, like, what Gen Z is all about and how they're going to shake things up. But the article also mentioned another big thing, diversity.
Yeah, Gen Z is the most diverse generation ever, in terms of race and ethnicity. And that's a big deal for healthcare.
Totally. But how does that, actually play out in the real world? What are the challenges and opportunities, within the healthcare system?
Well, different groups have different health needs, right? Like Black populations have higher rates of diabetes, and Latino populations have higher rates of obesity, and cancer is the leading cause of death for Asian Americans.
So it's not just about, like, being sensitive to different cultures. It's about understanding those specific health issues.
Exactly. And it goes beyond just, physical health. We have to think about cultural belief, how people view healthcare, language barriers if someone doesn't speak English well, and even historical mistrust of the healthcare system. Some communities have been treated really badly in the past.
Yeah, that's true. So it's about building a system that's, like, fair for everyone, a system that recognizes and addresses these inequalities.
Exactly. And that means healthcare providers need to be more aware, more sensitive, and more willing to adapt to the needs of a diverse population. It's not a one-size-fits-all kind of thing. It's about personalized care that respects people's cultures and backgrounds.
Wow, so much to think about. This generation is really changing everything. It's funny. As we were talking about all this, I was thinking a lot of these challenges Gen Z faces, like, we're all dealing with them too. I mean, who hasn't felt stressed out lately or totally overwhelmed by all the tech stuff or worried about, affording health care?
Totally. It's like Gen Z is holding up a mirror,
Yeah.
showing us the things we all need to work on. They're just experiencing it more intensely, more in your face.
So maybe by figuring out how to help them, we're actually figuring out how to help everyone.
Exactly. It's about building systems that are fair, more inclusive, more in tune with how the world actually works now.
It's about creating a world that's not just, surviving, but actually thriving.
Love that. And I think a good place to start is with that last question from the article that really made me think, what kind of world do we want to leave for Gen Z? What can each of us do to make sure it's a world where they can shine?
It's a big question, for sure. And one I hope, sticks with our listeners. Because at the end of the day, their success is our success.
Couldn't have said it better myself.
Well, that was a deep dive for sure. Thanks for hanging out with us today as we explored the world of Gen Z and the future of healthcare. Until next time, keep learning, keep questioning, and keep fighting for a better tomorrow.